when we're thinking about the anxiety disorders, if you would share more about what is an anxiety disorder.
Yeah, sure. So children can struggle with separation anxiety, which is, you have anxiety when your parent or your guardian or your adult figure leaves. Outside of that, children and adolescents struggle with a lot of the same anxiety symptoms that adults do. So generalized anxiety, obsessive compulsive disorder, panic disorder, specific phobias. Anxiety can be part of post-traumatic stress disorder. But one of the more common ones that we see is something called generalized anxiety disorder. And what that is sort of what the name sounds like. It's, you have generalized anxiety, but it's sort of about everything. And it's more than I'm worrying and then kind of moving on from that worry. It's I'm worrying persistently and daily. So I get into these ruminative thought processes and start to think about something over and over and over again. And I think about what ifs or worst case scenarios. And it starts to impact my functionality where I'm not able to go to school or I'm not able to go to work, or it starts to impact relationships with other people. What's tricky about generalized anxiety is a lot of times our thoughts are irrational. They don't make sense. But that anxious brain just tricks us into believing all of these things that are not accurate. A lot of people have maybe heard of panic attacks or know somebody who has had a panic attack. And what that looks like is they're usually brief episodes of overwhelming anxiety. So generalized anxiety is kind of more persistent. Panic disorders or panic attacks are very brief, overwhelming. People feel almost like they're going to die because the anxiety is so significant, or they have this sense of impending doom or something bad is going to happen. And it's often associated with a lot of physical symptoms. So sometimes people feel like they can't breathe, their heart is beating out of their chest, or they're having chest pain. Sometimes people will have sweats or get really tremulous or shaky. And the problem with these is because they're kind of short-lived, but also pretty devastating, we then start to have anxiety about having another one. Another anxiety disorder maybe we could talk about is something called obsessive compulsive disorder, OCD. A lot of times we'll say it as a society as, somebody who likes things in order or like things a specific way. We'll say, oh, they're so OCD. But it's actually more than that. OCD is somebody who struggles with obsessions, compulsions, or both of those things. And obsessions are kind of repetitive, intrusive, really negative thoughts that cause a lot of distress. So sometimes people can have obsessions about cleanliness or fear of contamination, or obsessions about something bad happening or something bad happening to a family member. And those kind of repeat over and over and over again and cause a lot of distress for them. And so one way to alleviate the distress is some people will engage in things called compulsions. That is kind of an act or a mental act to do to try and neutralize that anxiety. So an example of that would be if I have a fear of contamination, I am going to try and get rid of that fear by washing my hands. But the problem is, if I have repetitive, intrusive, obsessional thoughts, that really doesn't go away. So I end up washing my hands over and over and over again compulsively, to the point where it's gone beyond I'm cleaning my hands and now it's, I'm starting to have, skin breakdown or cuts because my hands are so dry. The challenge with OCD is sometimes the compulsions and the obsessions don't really make sense. So sometimes people will have obsessions about something bad happening to a family member. So I may be worried about something bad happening to my mother. And I think about it over and over and over again. And my anxiety will tell me I need to do something to prevent it from happening. So a lot of times people will end up doing things over and over again to try and prevent that. So I need to touch everything 5 times when I go by to avoid something bad happening to my mother. Or I need to do everything in pairs of 2 or pairs of 3 to prevent something happening to my mother. We shift a little bit because it's kind of similar as, specific phobia. So this is kind of a phobia. I'm afraid of something specific. So a lot of times people have a fear of flying or a fear of spiders, a fear of something specific, right?
Yeah, well said. Well, thank you.
Yep.